Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about breast histology, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss rationale and aims, learning outcomes, indicative content, resources, submission of evidence, Q&A ideas, evidence ideas, reflective statement, and some helpful tips to make candidates' portfolio better. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into this submodule. Rationale and aims of this submodule outline the general information and expected knowledge and competence that candidate needs to achieve when this submodule is completed. These are relevant to each submodule. For this submodule, the expectations are that the candidate will be able to prepare, process and stain breast histology samples, gain a clear understanding of the anatomy and physiology of breast tissue, the pathological basis of disorders of breast tissue and how these disorders may be investigated histologically. The learning outcomes demonstrate candidates' knowledge, skills, and competence in this submodule. They also include demonstration of the understanding of scientific principles, laboratory procedures, quality assurance, and professional conduct. They allow candidate to work autonomously and solve problems independently. The first learning outcome is, discuss how the anatomy and pathophysiology of breast tissue interacts. Candidate needs to know how anatomy and pathophysiology of breast tissue interact. Does the candidate know, what is the anatomy and physiology of breast tissue? Do they know, how anatomy and pathophysiology of breast tissue interact? Do they know, which diseases are most common in breast tissue? Do they know where those diseases originate in the breast tissue? Candidate could consider the ductal and lobular structures characteristic of breast tissue, terminal duct lobular unit, which is the functional milk-producing unit of the breast and also a place where most benign and malignant cancers originate, connective and adipose tissue and their interactions within the breast tissue being hormonally responsive tissue, changes during menstrual cycle, changes of breast tissue due to age, pregnancy, or menopause, tissue changes and their association with susceptibility to disease development, common disease origins like TDLU, stroma and possibility for malignant transformation, lymphatic system and its association with metastasis and cancer spread, tail of Spence, or axillary tail and its association with disease development. The second learning outcome is, discuss how pathological processes including inflammation, neoplasia, and infection relate to breast tissue. Candidate needs to know how inflammation, infection, and neoplasia affect breast tissue. Does the candidate know how inflammation, neoplasia, and infection affect breast tissue? Do they know the difference between inflammation, infection, and neoplasia in breast tissue? Do they know what are the pathological processes of inflammation, infection, and neoplasia in breast tissue? Do they know what are the histological features of inflammation, infection, and neoplasia in breast tissue? Candidate could consider inflammation and its acute and chronic form leading to tissue damage, inflammation and its association with fat necrosis, ductictasia and Zuska's disease. Infection of breast tissue or mastitis, leading to formation of abscesses, the most common lactational mastitis, infections mimicking neoplasia. Infection and inflammation leading to protumor environment and DNA damage. Neoplasia and its benign and malignant forms, CIS and LCIS, IBC, or inflammatory breast cancer. Candidate could consider pathological processes and histological features of inflammation, infection, and neoplasia. The third learning outcome is, explain when and why samples of breast tissue need to be prepared prior to dissection, as well as how this should be done. Candidate needs to explain when and why are breast samples prepared prior dissection. Does the candidate know how are breast samples prepared prior dissection? Do they know the steps taken during breast sample preparation? Do they know why are breast samples prepared prior dissection? Candidate could consider orientation, inking for margin identification, sutures like superior, inferior, medial, lateral, anterior and posterior for anatomical sample orientation, slicing the sample to improve fixation process, X-raying to identify presence of microcalcification or markers, sample description, weighing and measuring, different sample types like lumps, wide local excisions, or mastectomies, biopsies and VABs and their preparation differences. The steps might be specific to each department and sample type, therefore they could consider SOPs, methodology used or RCPAF and NICE guidelines. The fourth learning outcome is, explain dissection, tissue selection protocols and block selection rationale for samples of breast tissue, as relevant to your lab. Candidate needs to explain dissection and tissue selection for breast tissues. Does the candidate know how are breast samples dissected in your lab? Do they know what blocks are taken and why? Candidate could consider gross examination, clinical correlation, identification of clips, markers by imaging, using radiography for detection of microcalcification, block selection lymph nodes or axillary tail assessment, ensuring proper fixation to preserve morphology and protein integrity, neoadjuvant therapy and its influence on dissection steps. Selection of relevant tissue blocks from lesions, tumors, margins, surrounding tissue, nipple and lymph nodes. The exact steps are specific to each department and sample type. Therefore, candidates should consider SOPs, methodology used, RCPAF and NICE guidelines. The fifth learning outcome is, describe how normal and abnormal breast tissue stained using H&E staining should appear when viewed with a microscope. Use examples relevant to your practice. Candidate needs to describe normal and abnormal breast tissue on H&E stained slide. Does the candidate know how normal and abnormal breast tissue stained H&E look like microscopically? Can they identify abnormalities microscopically? Can they identify breast tissue on stained slides? Do they know the characteristic features of breast tissue that can be used to identify it? Candidate could consider characteristic features of breast tissue, normal tissue appearance like presence of ducts, lobules, significance of bilayered epithelium, basement membrane integrity, stromal appearance, cell uniformity, and normal breast architecture. Abnormal features like disrupted architecture, presence of invasion and cell infiltration, pleomorphism, nuclear abnormalities, mitotic figures, altered stroma, and so on. The sixth learning outcome is, explain when and why special stains, IHC markers, and other specialist histology techniques might be required to demonstrate abnormalities of breast tissue. Identify all the relevant stains and techniques. Candidate needs to explain the use of IHC and special stains on breast tissue. Does the candidate know why and when would special stains and IHC markers be used to stain breast tissue? Can they give examples of staining techniques used for breast tissue? Do they know why they would be used, and explain what they detect? Candidate could consider markers of stains like myoepithelial markers for invasive versus in situ, cytokeratins, prognostic and companion markers to guide treatment, specialist techniques for gene amplification, molecular profiling to identify molecular subtype, markers to distinguish between ductal and lobular origin, broad markers for primary origin identification, stains for highlighting mucins or fibrosis, specific IHC examples like P63, SMM, various cytokeratins to highlight more aggressive behavior, Ki67 and CMYC to assess mitosis, ER, PR, HER2, FISH, CISH, D-dish, GATA3 and mammoglobin. specials like ABPA and ABPASD, Meson trichrome. Molecular examples like Oncotype DX, MAMA-Print, or new generation sequencing to detect BRCA mutations. The seventh learning outcome is, describe the staining patterns you would expect to be able to view microscopically for each of the IHC, special, and other staining techniques listed above. Use examples relevant to your practice. Candidate needs to describe staining patterns in breast tissue. Does the candidate know the staining pattern of IH and special stains for breast tissue used in your lab? Can they recognize those staining patterns on stained slides? Can they distinguish between abnormal and normal staining pattern? Candidate could consider normal and disease-related staining pattern, marker and stain-relevant pattern, localization patterns like nuclear, cytoplasmic, Golgi or mixed staining, intensity of staining like negative, weak, moderate or strong. Distribution patterns like diffuse, focal, heterogeneous or peripheral. The eighth learning outcome is, demonstrate how you are involved in any part of the process between tissue preparation and reporting for a breast tissue sample. Candidate needs to demonstrate their involvement in breast tissue processing in the lab. Is the candidate involved in breast tissue processing in the lab? Can they explain their role in the process between breast tissue preparation and reporting? What tasks do they perform in the lab that are relevant to breast tissue samples? Candidate could consider the pre-dissection steps of sample preparation like inking, slicing, dissection steps and candidate's involvement like assisting or performing dissection, processing and the schedule used and why, embedding and any special instructions breast samples might have, microtomy and any special instructions, staining of breast samples with various methods, possible molecular analysis and referrals of cases, QC and block checking, digital scanning, and booking out cases to pathologists. This is very individual and depends on the training and competency of the candidate. The ninth learning outcome is, discuss how cellular pathology investigations impacts the management of patients with breast disorders. Candidate needs to know about how histology investigations impact patient management. Does the candidate know how histology investigations impact the management of patients with breast disorders? Do they know what information can be gained from histology results that can be used for patient management? Do they know if histology investigations can affect patients' diagnosis, treatment, prognosis, or monitoring? Can they list tests that can be used in histology to guide patient management? Candidate could consider lab investigations that distinguish between benign versus malignant, in situ versus invasive, tests enabling subtyping, grading, staging, differentiation, diagnosis, prognosis, guiding therapeutic decisions, lymph node status assessment, detecting lymphovascular invasion, genomic profile monitoring, establishing predictive value, digitalization of results for sharing and MDTs. The impact of investigations like offering surgical options, therapeutic options, personalized treatment, for monitoring disease progression, monitoring treatment response, prognosis, to speed up process and improve therapeutic accuracy. Indicative content highlights background knowledge that might be assessed during the viva. They may or may not be demonstrated by the learning outcomes or candidate's evidence. In this submodule, candidate is expected to have the knowledge and understanding relevant to tissue preparation techniques for samples of breast tissue. Basic and advanced staining theory for stains that may be utilized for samples of breast tissue. Quality control for basic and advanced stains that may be utilized for samples of breast tissue. EQA schemes for staining techniques associated with breast tissue. Detention requirements related to samples of breast tissue. The principles of tumor grading and staging with respect to breast tissue samples. Invasive and non-invasive surgical procedures and their relationship to the collection of breast tissue samples. Indicative content also highlights skills and competence the candidate is expected to be able to. For this submodule, candidate must be able to use microscope, Resources section on the Brightspace contains some very useful information for this submodule. Submission of evidence section on Brightspace informs the candidate what evidence needs to be submitted for each subsection. Candidate needs to submit answers to questions that were set by the training officer. I will share some examples of possible question suggestions later on. Candidate also needs to select an additional piece of evidence relevant to this submodule. For evidence ideas, please have a look at the video for trainee. Each submodule also requires the candidate to submit their reflective statement relevant to their practice and training in each submodule. These are some example questions you could give your candidate to test their knowledge, competence, and skills about this submodule. These should be based around the learning outcomes mentioned earlier. These are some more example questions you could use for this submodule. You could ask them to complete tables you created, based on the learning outcomes. Some more examples of tables, based on the learning outcomes, that could be used to test candidates' knowledge. Or you could use images to test candidates' knowledge and competence. Supporting evidence should be selected by the candidate. It needs to be based around the learning outcomes and indicative content, and be relevant for each submodule. The evidence should allow the candidate to demonstrate their specialist knowledge and competence in each submodule. It should be specific and relevant to the candidate's in-house practice. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Each submodule also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each submodule. How do they demonstrate that they can draw conclusion from what they have learned, reflect on their current practice and how it can change in the future due to gained knowledge? They could think about what is their lab role in context of this submodule. What impacts can their actions have on their colleagues, department as a whole and for the patients? They also need to write a personal reflection on their training in the lab, and explain why they chose their evidence. This is very personal to their own circumstance. It should demonstrate their ability to be self-aware when analyzing gaps in their knowledge. They can use it as an opportunity to reflect on aspects of their training, application of their gained knowledge and skills, and how they have achieved their goals. They should think about what their evidence demonstrates, and why they chose this specific evidence for this submodule. Also, they should write about what their training was like when it comes to this submodule and how their practice changed due to their training. Their reflective statements can also be used as a CPD evidence in case they are chosen to be audited by the HCPC. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, animations, pictures, posters, flowcharts, videos, photographs, PowerPoints, diagrams, graphs, infographics, charts. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like a case study, for each submodule. They could use experiments, case studies, annotated results, troubleshooting, controls production, annotated images, risk assessments, glossary, training presentation, certificates with reflective statements, nonconformances, validations, verifications, comparisons, ECHA results, annotated audits, kappa or DATIX, Q&A. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If they like experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the learning outcomes and indicative content in mind when they are selecting their evidence. Learning outcomes that require the candidate to demonstrate something would be ideal for covering with their evidence. And this brings me to the end of today's video. Hopefully you now have a better understanding about the learning requirements for this submodule. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those learning outcomes in mind when selecting questions and guiding the candidate. Bye for now.